So it is complete chaos right now in Italy because of the coronavirus scare. And it should be because it is a very serious disease. Corona chaos, Italy, coronavirus lockdown. Medical supplies looted and panic buyers strip the shelves as the whole country is quarantined. So it had set off a whirlwind of chaos. You can just look at the pictures. The whole of Italy has gone into lockdown, sparking panic buying and reports of looting as hospitals are overwhelmed despite desperate bids on to halt the coronavirus was announced last night. As the Italian PM extended a lockdown area already covering much of the north to cover the whole country. Read Coronavirus Live blog for the latest news and updates. So this is what is seen all over Italy. The panic buying, the long lines, the frustration, the people wearing the mask, people in fear, and chaos ensues. The lockdown announcement sparking a wave of panic buying all over in stores. Well, guess what? It's happening here in California. It's happening in all of the U.S. states. The panic buying, the long lines, the stores, and now also you have people filling their shopping carts up and just walking out because of frustration of standing in long lines such as these. So I'm going to go into this because not only has Italy seen chaos, the U.S. is now seeing chaos. People standing outside of shops in Rome after the lockdown announcement, and it's complete chaos. Filling their baskets, locals emptied the shelves of goods at the shops across Italy. The move will see all public events banned, cinemas, gyms, and pubs closed, funerals, weddings canceled, sporting matches, including Series A games suspended. Guess what? In the U.S., the same thing. They have closed some schools. There's university and schools. There's elementary schools that are closed. There are 33 states that have deployed the National Guard as we speak now in the U.S. And I will go into that. It is complete chaos because of the coronavirus. So pictures show huge lines, long lines of people outside of shops as shelves were left bare, empty. There were also reports of vital medical supplies being looted as chaos ensues and grips the country. And so Marco de Monteproli, director of hospital in Liguria region of Italy, told the Wall Street Journal, these are episodes of looting at a time where these health devices are so critical and important. Hospitals are overwhelmed. And one Italian doctor said that his hospital is being overwhelmed by the tsunami of patients he's getting. Dr. Danielle Macchini, who works at the Humanities Gavanzini Hospital in Bergamo, Northern Italy, wrote on Facebook, the war has literally exploded and the battles are uninterrupted day and night. So it is completely chaotic right now all over the country. And so the results of the swabs, what are the results? Positive, positive, positive. Suddenly the emergency room is collapsing. Doctors now face having to make life and death decisions about who to treat, and with medics told to consider the patient's age and their chance of survival. Dr. Christian Solaroli told the Brussels Times, if a person is between the ages of 80 and 95 years old and has severe respiratory failure, it's likely we will not go ahead. If they have multiple organ failure with more than 2 or 3 vital organs, it means that their mortality rate is 100%. Coronavirus emergency, and this is what is felt all over in Italy, cities that are hit with the most problem of coronavirus. Emergency vehicles have reportedly been driving through the streets at night to enforce lockdowns, telling people on loudspeakers to stay indoors. One unverified clip, undoubtedly you can see, filmed here in Naples, shows a car with blue flashing lights patrolling the narrow alleyways and blasting out coronavirus emergency, coronavirus emergency. The mayor encourages every citizen to stay at home, avoid going out if not necessary, avoid gatherings, and avoid crowded places. Watch this video after the commercial plays.
Hey, King Midas, people should know we can service their whole car.
Yes. Tires, brakes, oil, everything.
Shortly after the commercial plays, I will show you the video, but it is chaos. This is what people are hearing in Naples.
Tutta la cittadinanza di restare in casa, evitare uscite inutili, evitare gli assembramenti, evitare di andare nei luoghi affollati. Grazie. Emergenza coronavirus. Il sindaco avverte tutta la cittadinanza di restare in casa, evitare uscite inutili, evitare gli assembramenti, evitare di andare nei luoghi affollati. Grazie. Emergenza coronavirus. Il sindaco avverte tutta la cittadinanza di restare in casa, evitare uscite inutili, evitare gli assembramenti.
Complete chaos. That is what is happening. And that is what the people are hearing, and that is what they're seeing. Complete chaos. Now, what's happening here in the States? Not much different. Just as scary and just as chaotic. There's panic buying. There's people buying water, tissue, whatever cleaning products, Lysol, bleach. They're cleaning the shelves out. People are fighting. They're in long lines. They're frustrated from waiting in the long lines. They just take their basket and walk away. And so this is what is being felt here. So what are they doing here in the States? The National Guard activated to combat coronavirus spread in 6 states and more to follow. Currently, from what I was hearing, 33 states to be exact, and probably more on the way. So this is what we're seeing. New York Army National Guard soldiers distribute food parcels in Westchester County, New York on March the 12th and 2020 as part of the New York State response to the effort to contain the cluster of coronavirus, also known as COVID-19 cases in New Rochelle, New York. The soldiers and airmen were providing food to families to make up for school lunch, breakfast meals students are missing after schools. What has happened here? I'll tell you, in LA and California, there are school closures. In Pasadena, there are school closures. And in some of the outskirts of the LA sister cities, there are school closures, universities that have closed. There's shopping stores where people are frequenting and they're cleaning the shelves off. And they're working overtime to restock the shelves with not even having a dent in putting back the things that people are taking off. As soon as it ends up on the shelf, as fast it comes down. So around 400 National Guard personnel have been activated across 6 states to support operations to stem the spread of the novel coronavirus, which is now called COVID-19 here in the U.S. The National Guard Bureau said in a press release. So the governors of Florida, Iowa, Louisiana, New York, Rhode Island, and Washington have all activated components of their army, and the Air National Guard guardsmen in California and Maryland are also expected to join their states in efforts today. National Guard is fully involved in the local, state, and federal level in planning and the execution of the nation's response to COVID-19. A National Guard Bureau spokesperson said in the release. So in times of emergency, the National Guard Bureau serves as a federal coordinating agency should a state require assistance from the National Guard of another state. At the national level, Guard members are training personnel on COVID-19 response, identifying and preparing National Guard facilities for the use of isolation and housing, and compiling state medical supply inventories. The release continued. National Guard personnel will provide assistance to the states that include logistical support, disinfection, cleaning, activate, conduct transportation of medical personnel, and call center support and meal delivery as well. Which sounds to me like they're going to put places on lockdown, and that is the fear, and that's what is sparking the panic buying out here in the U.S. and in LA. I personally have been to some Costco's and some Rite Aids. You can't find any hand sanitizer, and you cannot find hardly any tissue. You can barely find paper towels on the shelf, and people are constantly going in there and forming long lines to clean everything out that they feel they're going to run out, and they use most of day to day. There's fear that there's going to be statewide or citywide lockdowns everywhere. And so people are rushing and making a mad dash to as many stores as they can to get all of their supplies in the event of complete chaos, which is already unfolding. Just today in a Big Lots, there was a woman that filled her basket full of supplies and walked out because she didn't want to stand in the line. And so it has created a panic buying here, just like in Italy. So it's not much difference that what we see going on in Italy that is happening in the U.S. So while the number currently stands, back to the article, at under 500, the National Guard said that those numbers will rapidly change as the agencies expect. That's not sounding too good. That number to approach 1,000 by the end of the day. And so that's scary, because the more National Guard and the more states that they have declared emergencies, the more fear is going down all over. Currently, 33 states have declared states of emergency to mobilize greater resources and streamline responses to the new coronavirus outbreak, the Bureau noted. Individual state responses. And here it goes. On Monday, Florida Governor Ron DeSantis signed an executive order to grant greater authorities to the state officials. 3 guardsmen are currently providing support at the State Emergency Operations Center in Tallahassee, Florida, and on Sunday, an additional 20 service members will be activated to operate the state's Logistic Readiness Center, according to an official with the Florida Army National Guard. As of Friday, there were 42 confirmed cases of COVID-19 with 2 confirmed deaths. 147 pending test results in Florida, according to the state's health department. Rhode Island Governor Gina Raimondo also signed an emergency declaration on Monday authorizing Armage General Christopher P. Callahan, the state's adjunct general, to order the Rhode Island National Guard to active duty status. I want every tool at my disposal in order to be able to protect Rhode Island. Raimondo said this on Monday's press conference, as reported by NBC 10 Boston. Around 10 guardsmen are currently supporting the state's health officials in Rhode Island, where 5 cases of COVID-19 have been confirmed as of Thursday, with 29 pending test results. So in Iowa, Governor Kim Reynolds signed a proclamation of disaster emergency. Just hearing this tells you something's going on, and it's very scary. So I had to stop for a moment. What am I hearing in the streets from just average people? It's a hoax. It's propaganda. It's not real. It's just because it's election year. It's not real. It's not that bad. The flu is worse. I'm still hearing that from people despite all of what is going down and all of the panic buying and these National Guard being deployed. Also, people are not trusting of the government, so there's a lot of fear even in that. Some people think this is depopulation time, that it's a tactic that they're using so that somebody release something in society so that they can get rid of the homeless and get rid of the poor. And so they feel that it's another tactic to try to kill off thousands of people and harm thousands of poor people. So there's a lot of skepticism about this whole thing, a lot of fear involved in all of this. So right now, here it says in Iowa, Governor Kim Reynolds signed a proclamation of disaster emergency on Monday to streamline the response and assistance procedures. So some personnel of the Iowa National Guard have been activated under state active duty status to assist in the State Joint Emergency Operations Center, a state official has said. Currently, the National Guard's presence constitutes a very small footprint, serving primarily as a liaison for logistics and planning, the officials have added. As of Thursday, Iowa has 16 confirmed cases of COVID-19 with 29 cases pending, 128 people being monitored according to the Iowa Department of Public Health. Most of the cases stem from travel, according to also including the cruise in Egypt, and the governor's office has said this. So in Louisiana, the guardsmen are providing assistance for the COVID-19 planning in New Orleans Office of Homeland Security and Emergency Preparedness, according to the release. Governor John Bel Edwards declared a public health emergency on Wednesday that the state does not yet have any confirmed cases that they know of, but there are 33 presumptive cases as of Friday. March 5th, Maryland Governor Larry Hogan declared a state of emergency, mobilizing a statewide response to the outbreak. The state currently has confirmed 17 cases of COVID-19, according to the Maryland Department of Health. Components of Maryland National Guard have been activated by the governor, but their role is to be determined at this time, according to the National Guard Bureau. Governor Larry Hogan, you can see him on Twitter. Today I convene a call with the county leaders to provide updates and guidance on the statewide response to COVID-19. We are going to continue working closely with all levels of government as we take a comprehensive collaborative approach to this public health emergency. California Governor Gavin Newsom here in California is activating personnel utilizing a 10-person medical augmentation team from 144th Fighter Wing of the California Air National Guards. So to provide emergency pre-hospitalization or a pre-hospital stabilization response for up to 24 patients per 24-hour operation, the release has stated. So the state has 174 confirmed cases of COVID-19 with an additional 11,000 people self-monitoring, according to the California Department of Public Health. And so Washington Governor Jay Inslee, who issued an emergency proclamation on February 29th, has also activated personnel from the Washington National Guard. These guardsmen are supporting planning efforts within the Washington State Emergency Management Division for up to 45 days, according to the release. There are currently 31 cases of COVID-19 in the state, according to the state health officials. The developments in these states follow New York Governor Andrew Cuomo's decision earlier this week to activate guardsmen to assist in cleaning and food deliveries. Puerto Rico Governor Wanda Vasquez Garcet's decision on Thursday to activate the Puerto Rican National Guard to screen passengers at the island airport and cruise ships as well. And so you can see Andrew Cuomo right here on Twitter as well. Today we open the State First Drive. They have a drive-through COVID-19 mobile testing center in New Rochelle. And so the mobile testing center has 6 lanes. They can test up to 200 people today and up to 500 people a day in the coming days. So it is not only faster and easier, it is also smarter and safer. The New York National Guard has responded to New Rochelle, New York, where a cluster of COVID-19 cases have been identified as well. So New York now has 378 guardsmen assisting with disinfecting and cleaning of common public spaces and providing transportation support and nurses and healthcare providers, the release has stated. So National Guard activation status. A state governor may activate the National Guard under state active duty status in response to natural or man-made disaster or homeland defense missions. So in this capacity, guardsmen remain command and control of the governor and are sourced and paid for by the state according to the National Guard Bureau. So across 50 states, 3 territories, and the District of Columbia, there are approximately 450,000 Air and Army National Guard personnel who frequently train side by side with state and local emergency responders in domestic operations, the National Guard Bureau noted. A governor may also activate guardsmen to support other states through assisting agreements. In a multi-state response to an emergency, although the funding comes from the federal government under Title 32 U.S.C., the National Guard has unique capabilities such as the civil support teams and radiological, nuclear, and high-yield explosive enhanced response force packages that could provide local first responders with additional resources to combat COVID-19, the release added. The Defense Secretary retains the authority to order National Guard forces to active duty under U.S.C. Title 10, as it's called, when necessary to maintain the national health, safety, or interest according to the Department of Homeland Security. National Response Framework. The Centers of Disease Control and Prevention is the lead federal agency tasked with combating the spread of COVID-19. As of Friday, the CDC has reported over 1,600 cases with 41 deaths, although widespread testing has yet to be implemented nationwide. And so with that being said, I'm going to let this video go, but what do you think about all of this? Some people are saying it's a hoax. Some people say it's propaganda. Some people say it's because it's election year. Some people say there's a twist of a plot to get rid of the homeless and the poor. Some people think that it is just depopulation time and that there's so many people on the planet that they're trying to thin in the herd. There's lots of theories, lots of stories. Some people feel that somebody was angry with the government and with the way things were going, and they just released something so that they could just do away with a lot of people for their own evil doing. Some people feel like this was government orchestrated. Some people feel like there's a crazy plot behind all of this, and a lot of people are in fear of what's to come. What do you think about this? This is so scary right now, and nobody knows how this is going to turn out. So this is the scene that was in Italy with all the chaos ensuing, long lines. It's definitely the scene here in California with the long lines, the panic buying, people buying as much as they can, and the scares that people are having. I'm going to end this with what the president of Italy said, but it's going to be in a different
Check
language.
catering off your to-do list with Easy Cater. Tons of local menus, easy online ordering, award-winning customer service. See for yourself why millions of office pros nationwide.
È per questo che sto per firmare un provvedimento che possiamo sintetizzare con l'espressione "io resto a casa". Non ci sarà più una zona rossa, non ci sarà più la zona 1 e la zona 2 della penisola. Ci sarà l'Italia, un'Italia zona protetta. Saranno quindi da evitare su tutto il territorio della penisola gli spostamenti, a meno che non siano motivati da 3 specifiche circostanze: comprovate ragioni di lavoro, da casi di necessità o anche per motivi di salute. Aggiungiamo in questo provvedimento anche un divieto degli assembramenti all'aperto in locali aperti al pubblico. Abbiamo e comprendiamo la voglia di socialità anche dei giovani, abbiamo visto tutti episodi, fotografie anche dove la movida, c'è molto divertimento, si consumano anche delle bevande al di fuori dei locali e dei bar. Non ci possiamo permettere più queste occasioni di aggregazioni che diventano occasioni di contagio. Credetemi, non è facile. Sono pienamente consapevole della responsabilità e anche della gravità nell'adottare queste misure per tutta la penisola, ma sono costretto a intervenire in modo ancora più deciso per proteggere tutti noi e soprattutto le persone più fragili e più vulnerabili. Viviamo in un sistema in cui noi garantiamo la sanità e il diritto alle cure e alla salute a tutti. È un fondamento, un pilastro e direi la caratteristica del nostro sistema di civiltà. Non possiamo quindi permetterci su questo di abbassare la guardia. Oggi è il momento della responsabilità, noi tutti abbiamo una grande responsabilità, voi con me, voi cittadini tutti con me. Penso anche a tutti i medici, gli infermieri che sono in trincea in queste settimane, che lavorano senza sosta, stanno facendo di tutto, con turni molto impegnativi per assistere e curare le persone contagiate dal coronavirus. Oggi, nel prendere queste misure, dobbiamo pensare anche a loro, che rischiano, pensate, con grande gesto di solidarietà, la propria salute per curare la salute del prossimo. La decisione giusta oggi è di restare a casa. Il futuro nostro dell'Italia è nelle nostre mani e queste mani devono essere mani responsabili, oggi più che mai. Ognuno deve fare la propria parte ed è per questo quindi che da oggi varranno su tutto il territorio della penisola queste misure che noi abbiamo già predisposto per la parte settentrionale, come sapete, Lombardia più provincia, in più province, giusto qualche giorno fa.
Well, there you have it, folks. That is what is going on. And basically, he, as the president in Italy, he is basically summarizing what has gone on,
how we look.
And
Great eyewear is all about both thoughtful design,
calm, and that they're
people
trying
love.
to keep things
So
under
you can see
control.
the world the way it's meant to
And
be
also
seen. In
the
perfect
bans
focus.
that they have on
Zenny.com.
public gatherings.
Eyewear for everyone.
That is happening here in the States, in the U.S.
You
There
talked
have
this
been
week about the UK
elementary
doing a good
schools that have
job in
been
tackling
closed.
coronavirus.
There have been
in light of the rise in cases, are you
LAUSD
changing your mind about
has
that? You also
closures,
just
PUSD
spoke about
has
possible
closures.
travel restrictions.
There
Have you
are
discussed
schools on
when
the
they might be
outskirts
put in place?
of Los
Well, in light of the
Angeles
results,
and,
as we
Pasadena
discussed
that
before,
have
in light of the
closures.
results, we're going to be
There's
looking at
also
it, and I know the
some people
task
that have
force is
tested
looking at it very
positive
strongly, Vice
at,
President, everybody.
some of
It was
the
looking good, but
schools
they've,
that
the
have
results have been building up pretty
quarantined
rapidly,
themselves
so
or either
we'll be taking another
show
look at that. Yes,
positive tests.
absolutely.
We won't say the names of those individuals because it's confidential, but there have been closures behind that. There have been closures behind also parents that possibly may be quarantined because they fit the criterion of having contracted or been near or exposed to COVID-19. There are school closures at not only just the elementaries, but the universities as well, for maybe a week, 2 weeks, a month. Sometimes they are reiterating messages to people, to students, that they're going to start getting together and trying to move some of the classes online. And so that is also what is going to happen. And so it's very scary, very, very scary. And so these are scary times that we're living in, and that is what is being stated and some of the messages that come in emails to parents about what the plans are. That's what I've been hearing. I've been hearing from people that they feel like it's a hoax. They feel like somebody's plotting something. They feel like it's the government.
So you're optimistic that we'll be able to fix this?
They feel like somebody messed up in a
we are
lab.
going to fix it, for
somebody
sure.
was angry.
And we're going to fix it. I mean,
There's
we
a
have to
black
admit
market
that
for
in the beginning we didn't have what we needed, but now we will fix it.
And so at this point, who needs to advocate in order to build the capacity for the universal virus testing?
And that's how it
No, it's
also
already
was
being done.
released
I mean,
into
the HHS on the Secretary Azar, the CDC, the FDA,
have
they're
people
all
that are
working
feeling
right now
these
to
are
get
the
this
mixed
done.
emotions that just random people in everyday society here in LA.
Our patented new Deadlock Cam is the simplest way to achieve perfect aero flight, and the only system that will lock it in permanently. Deadlock. Tune it, lock it, trust it. The only cam that locks in accuracy, only by Bowtech.
They think it might be propaganda. Then some people say they're very afraid that it's real, that it's something released into the air. I even heard some people say it had to do with climate change because the ice caps were melting and that it was something locked away and it was released into population. And it was always there, but it hadn't been released until the ice started melting. Believe it or not, I've heard these stories. So what do you think about it? What's your version? What do you think this is all going to amount to? From what I heard, coronavirus, when people do get it, it is very fatal. It can shut down major organs. These are the scenes that are happening in Italy, the looting and whatnot. And so I took it upon myself here to actually look up coronavirus because I wanted to know, there's so many videos now and people are concerned about what are the risks, what are the symptoms. That is out. You can look at that. It's even on most social media. Coronavirus. There's carriers. Some feel it's a bioweapon. Coronavirus.
Oh my God! Y'all, he choked her.
So what are the symptoms? It can be difficult to tell the difference between the new coronavirus symptoms and the seasonal flu, but the CDC lists the main telltale symptoms as fever, cough, shortness of breath. With a severe case of COVID-19, person may experience weakness, lethargy, fever,
my hands are
a
everything
prolonged
to me.
period of time.
But I was diagnosed with Dupuytren's contraction,
and so, however,
and it got to the point where things I took for granted
cases,
got tougher to do.
Might not
Thought
even
surgery
show
was my only option.
having this virus, but
Turns
still
out,
test positive
I was wrong.
if they've been
so when a hand
exposed.
specialist told me about non-surgical treatments, it was a total game changer.
People are fearing the worst, and so it has caused people to fear that they could be possibly in danger of losing their life. Causes, treatments,
like you,
types,
my hands have a lot more to do. Learn more at vaxonhand.com
that
today.
are similar to any other upper respiratory infection, including runny nose, coughing, and sore throat, sometimes fever. And so if you want to find out anything about coronavirus, there's lots of information all over about the symptoms and whatnot, and the causes and the treatments and what have you. And so what I heard in reading these informations or pieces of documents, saying that coronavirus means a handful of diseases, and it's a family of viruses that can cause illness, such as the common cold, acute respiratory syndrome, which is SARS, the Middle East respiratory syndrome, which is MERS. And so it's a new virus called 2019 novel. And so that is what people are in fear, because it said that it can live, that virus, on surfaces for anywhere the minimum 2 hours to as long as 9 days, depending on what types of surfaces it can survive on. So that's why it's so highly contagious, and that people must disinfect and clean so that they won't continue the spread. And so it's very scary. So this is what is happening here in California. The National Guard has been deployed, and the Air National Guard has been deployed, and it is the real deal here. So with all of the things that people are thinking and saying and wondering what is going on, and then you have some people that feel like they're unmoved because they haven't seen any major events occur, we shall only have to wait and see how this turns out. Having said that, like, comment, subscribe, and thank you so much for listening.